The primary purpose of walking allows for an individual to move from place to place by means of his or her own mechanisms or power. It occurs in the sagittal plane along the transverse axis. Walking is characterized by the translation of the body's center of gravity forward as a result of the alternating pattern of the lower extremity joint movements during the stance and swing phases. The forces that control walking are the external forces of weight, normal reaction, friction, air resistance, and internal muscular forces. The direction and interaction of these forces determine the nature of the gait. Walking is classified as an open skill, which means it is usually carried out in an unpredictable, ever-changing environment.
Phase 1, swing phase. When forward motion has been passed on to the trunk by means of the ground reaction to the backwards thrust of the leg and foot, it tends to continue unless restrained by any other force. Once the center of gravity passed beyond the base of the support, it is essential to restrain the action of the trunk until a new base of support is established. Hence, as the foot is brought to the ground in front of the body at the close of the swing phase, a restraint or loading phase is constituted. This diminishes as the leg approaches mid-stance. During the period that the foot is in the front of the center of gravity, there is a forward component of the force in the thrust of the foot against the ground. The result in a backward or braking reactive force of the ground against the foot, which is transmitted to the leg and then to the trunk.
Phase 2, support phase. Foot strike, foot flat, and toe off produces the period of double support when both feet are on the ground. Double support phase is characteristic of the walk and serves to differentiate it from running. A stride is one full lower extremity cycle. A stride is defined as being from one foot strike on one leg to the next foot strike with the same leg. Step starts with the foot strike on one leg and ends with foot strike on the contralateral or opposite leg. Gravity and momentum are the chief sources of motion for the swinging phase. It represents ballistic type movement. Source of motion for the support phase is, for the first half, the momentum of the forward moving trunk, provided by propulsion action of the other leg, and second half, the contraction of the extensor muscles of the supporting leg.
The inertia of the stationary body is overcome by the horizontal component of the propulsive force. Because periodic movement is characterized by an alternating increase and decrease of speed, the inertia must be overcome at every step, and the greater the weight of the body, the greater is the inertia to be overcome. As the center of gravity moves forward, it momentarily passes beyond the anterior margin of the base of support, and a temporary loss of balance results. At this point, the downward pull of gravity threatens a complete loss of equilibrium. A timely recovery of balance is effected, however, as the foot is placed on the ground. Thus, a new base of support is established and a new support phase is begun. The downward force of the body's weight is countered by the vertical reactive force through the feet. If the vertical force exceeds the need to balance the gravitational force at the time of push-off, an exaggerated lift to the body results, causing a gait characterized by a bounce or unusual spring.
Joints. Arms swing during the gait are beneficial for balance and preventing trunk rotation. If the arms do not swing, the trunk will rotate with the pelvis, which will tighten up the gait. The upper extremities have very little action in terms of flexion and extension in the locomotion of walking. The arm tends to swing in the opposite to the legs, meaning the left arm swings forward as the right leg swings forward, and the right arm swings backward as the left leg swings backwards, and vice versa. This action of the upper extremities are not accomplished with oblivious muscular involvement. The swinging of the upper extremities primarily serve as a balance for rotation of the pelvis.
The arms may not be moving with much muscular effort, but there is a force that acts upon them, causing the swinging motion. First, the middle and posterior deltoids and teres major. The middle deltoid is the muscle primarily causing the anterior movement of the arm. Although it is a very minuscule amount, it still causes action. Also, the anterior deltoids contracts, but only at the end of the backward swing to initiate the forward swing of the arm. The posterior deltoid and teres major are used mainly during the posterior swing, more the teres major than the posterior deltoid. The middle deltoid also acts not on the actual swing, but it prevents the arm from rubbing against the body during walking. It contracts slightly, causing abduction, but at a very minimal level.
The actions taking place on the joints in the lower extremities are essentially flexion and extension. Pelvic girdle cooperates in movements of the lower extremities. Pelvis has a double task: transmitting weight of body alternately first over one limb and then the other, putting each acetabulum in a favorable position for action of the corresponding femur. Phase 1 in regards to the spine and pelvis. Muscles involved include the semispinalis, rotators, multifidus, and external oblique muscles on the side, erector spinae, internal oblique, psoas and quadratus lumborum, gluteus medius, and minimus. Semispinalis, rotators, multifidus, and external oblique abdominal muscles on side toward which the pelvis rotates. Erector spinae and internal oblique abdominal muscles on opposite side. Rotation of the pelvis to the right causes rotation of the spine to the left. The psoas and quadratus lumborum help support the pelvis on the side of the swinging limb, and the gluteus medius and minimus on the supporting leg side support pelvis against pull of gravity.
The hip. The muscles, the iliopsis, assisted by the rectus femoris, serratus gracilis, adductors longus, pectineus, and bicep femoris. The serratus. The hamstrings contract with the moderate intensity during the knee extension to prevent the leg from swinging forward too rapidly. Eccentric contraction at a very minimum level. The iliopsis is the prime mover of the hip in the swing phase. It is assisted by the rectus femoris, serratus gracilis, adductor longus, and pectineus, and during the late phase of the swing, the short head of the bicep femoris. The latter part of the swing phase, hip is not really engaged when walking on a normal level ground. The basic nature of the movement is bastilic. The gluteus maximus and the medius contract slightly at the very end of the swing. Some other assisting muscles are the adductor longus and mangus, and some sources argue that the brevis is engaged while others say that it is not used. The muscle contract after halfway mark of the swinging limb phase.
Phase 1 of the knee. Flexion during the first half and extension during the second half. Muscles. Remarkably little muscular motion in the swing phase of normal walking. Flexion. During the swing phase of the flexion, it is produced during the toe off as the knee extensors relax. Extension. The quadriceps extensors contract slightly at the end of this phase. The action of the sartorius, a two-jointed muscle, has already been mentioned in the connection to the hip. Movement is primarily initiated by gravitational force and is continued by momentum. This force is enough to go through the complete swing phase. Perhaps at the end of the swing phase do the quadriceps contract fully to extend the leg.
Movement of the ankle includes dorsiflexion and prevention of plantar flexion. Muscles of the ankle include the tibialis anterior, extensor hallucis longus, contract beginning of the swing phase and taper off during the middle portion of phase. At the end of the swing phase, this group of muscles contracts with considerable force in preparation for the foot strike, which is the beginning of the support phase. Plantar flexors are completely relaxed throughout the entire swing. Phase 2, regarding the spine and pelvis. Muscles involved means that it's a low level of contraction from internal and external obliques. Rotation of the pelvis towards same side and spine to opposite side. Lateral tilt is away from the supporting leg. The trunk and core of the body contract when the heel strikes, causing stability. The arms aid in this stability with the contra movement to the lower extremities. Biomechanics of the spine and pelvis are involved with the forward trunk. The forward moving trunk meets with air resistance, which tends to push it back. By inclining the body forward, the pull of gravity is utilized to balance the force of the air resistance. Under normal conditions, this force is negligible and will not be noticed. When walking against a strong wind, it is necessary to incline the body farther forward to maintain balance. If the air resistance is not balanced by the force of gravity, it must be balanced by the contraction of the abdominal and other anterior muscles of the neck and trunk. If the body is inclined too far forward, however, the force of gravity acts too strongly on it and must be counteracted by tension of the posterior muscles. Thus, the proper degree of forward inclination is a factor in muscular economy.
Phase 2 of the hip movement. Extension through the flat foot to toe off, reduction of outward rotation followed by slightly inward rotation. This prevents the abduction of the thigh and drop the pelvis to one side. Pure heel strike. The gluteal muscles and hamstrings contract statically with moderate intensity, ceasing contraction during foot flat and disappeared at mid-stance. The only muscle of the hip that contract apprehensively are the abductors mangus and longus, and possibly the brevis. The hamstring apparently have but a small part in the support phase of normal walking. Only the long head of the bicep contracts at all. Even when the bicep contracts, is only slightly at the beginning of the phase.
Phase 2 of the knee movement. Slight flexion from foot strike continuing into foot flat, followed by extension from mid-stance until heel lift, when flexion for swinging phase begins. This flexion during the stance phase flattens the vertical path of the center of gravity of the body. By doing this, the efficiency of the gait increases. The muscles, quadriceps extensors contract moderately in early part of the support phase and relax gradually. They still remain slightly flexed during the support phase. As leg readies vertical position, the knee joint locks and contraction of the extensors are unnecessary. The hamstrings are completely relaxed at the end of the phase, but there is an abrupt increase in their action in the second half of the support phase. When the body's momentum is getting closer to the toe-off, the hamstring contracts, causing the knee to flex and preventing the swinging foot from hitting or dragging on level ground.
Ankle and foot movement. Slider plantar flexion followed by slight dorsiflexion. Considerable action of the tibialis anterior in the early part of the supporting phase. This is essentially contraction because it allows the foot to slowly set on the floor instead of slapping it down on the level ground. The only time that the tibialis anterior activates again is during the toe off. The gastrocnemius and soleus becomes active from mid-stance to heel off, contracting eccentrically to control the dorsiflexion as the center of the gravity continues moving forward. Peak contraction occurs from heel off to toe off as the foot pushes against the ground to initiate the next step. The tibialis posterior is mostly active during the middle part of the support phase. It prevents pronation of the foot. Both the peroneus longus and tibialis posterior cooperate on stabilizing the leg and foot in weight bearing. The gastrocnemius and soleus acts to decelerate the lower leg and stabilize the knee at mid-stance. Their activity increases dramatically after the heel lifts and continues until the opposite foot contacts the ground. This is when both feet are on the ground, also called double support.
Biomechanics are involved through the degree to which the pressure of the foot actually imparts motion to the body in the propulsive phase and restrains it in the restraining phase is in the direct proportion to the counterpressure of normal reactive force of the supporting surface. If the surface lacks solidarity, as in the case of mud, soft snow, and sand, it offers too little resistance to give the needed counterpressure. The pressure of the foot results in slipping or sinking, and more pressure must be applied to achieve even a slow forward progress. Therefore, the efficiency of the gait depends on the foot and the counterpressures of the supporting surface.
Like counterpressure, friction is also an essential factor in the effective application of the forces needed in walking. Because of the diagonal thrust of the leg at the beginning and end of the support phase, friction between the foot and the ground is essential so that the counterpressure of the ground may be transmitted to the body. For effective walking, friction must be sufficient to balance the horizontal component of force. If it is insufficient, the thrust of the foot results in the slipping of the foot itself rather than the desired propulsion of the body. The greater the horizontal component of force, as when walking with a long stride, the greater the dependence on friction for efficient locomotion.
Mechanical principles in walking. A body at rest will remain at rest unless acted on by a force. The force for walking is ground reaction force produced by extension of the lower extremities against the resistive surface. Because walking is an alternating pendular motion of the lower extremities, the inertia of the body must be overcome at every step.
A body in motion will remain in motion until acted on by a force. Once motion is imparted to the trunk by the backward and downward thrust of the legs, the trunk has a tendency to continue in motion even beyond the base of support. A brief restraining action of the forward limb serves as a brake on the momentum of the trunk.
Translatory movement of the layer is achieved by the repeated alternation of two rotary movements. The lever first turning about one end and then the other. In walking, the lower extremity alternates between rotating about the foot's point of contact, support phase, and the hip joint, swing phase. When muscles act to stop or start rotation at one end of the lever, power may be transferred or absorbed from other segments. This power flow is cyclically in walking.
Force applied diagonal has both horizontal and vertical components. The vertical components of the ground reaction force used in walking serves to counteract the pull of the gravity. The horizontal component of the force serves to a check forward motion of the trunk during the heel strike, and B, produce forward motion of the trunk during heel off and toe off.
The speed of walking is increased by increasing either the stride length or the stride rate or both.
The speed of the gait is directly related to the magnitude of the pushing force and to the direction of its application. This force is provided by the extensor muscles of the lower extremity, and the direction of the force application is determined by the angle of the lower extremity when the force is being applied.
As propulsion of the body is brought about by backward and downward push of the foot against the supporting surface, the efficiency of locomotion particularly depends on the friction and ground reaction force provided by the surface.
The efficiency of gait is related to its timing with reference to the length of the limbs. The most efficient gait is one that is so timed as to permit pendular motion of the lower extremities.
Walking has been described as an alternating loss and recovery of balance. This being so, a new base of support must be established at every step.
Stability of the body is directly related to the size of the base of support. In walking, the lateral distance between the feet is the factor in maintaining lateral stability. Average step width is about 10% of the leg length.
While wearing a knee brace can help in a healing process, there are several changes that occur in the gait. Some of the more visual changes occur with the stride length. Since the knee is no longer able to extend properly, the distance that heel strike is less than that if the subject was not wearing the knee brace. The use of muscles changed dramatically as well. The knee is no longer able to do flexion and extension, so it no longer uses the extensors and flexors. These movements are vital so that the foot does not drag or hit the floor while moving forward. There is now a need for the hip abductors to be used. The tensor fascia lata, sartorius, gluteus maximus, and medius all work together to help abduct the right leg, just out far enough so that it does not hit the level ground. While walking with the knee brace, the upper extremities are used more than in normal natural walking. In order to keep a constant speed as that of natural walk, subject had to increase muscle action that assists in the propulsion of the body. In order to achieve natural walking after using the knee brace, one should consult with a physical therapist or walking coach to correct any bad habits that were retained while wearing the knee brace.